afternoon. I'm Michaela Miller with the Tuesday edition of our City COVID-19 News Show. We are updating you on the latest information and resources around the COVID-19 pandemic while unpacking deeper issues as they emerge. We have just returned from the Easter long weekend. Western Cape traffic officials are repeating calls for the public to stay at home after news that dozens of motorists and taxis were turned back at the Eastern Cape border. Over 600 people have been arrested since the start of the weekend in the province. We will have more on that story tomorrow. And on today's program, we will unpack more about the Mpilweni land occupations that took place this past week. We do encourage our viewers to get in touch with us. We want to hear from you as we welcome contributions from movements, healthcare providers and our audience. We want this program to be a two-way flow of information, so please get in touch with us via our social media platforms and our email. And now for the news. As we enter day 19 of the national lockdown, the number of confirmed COVID-19 cases stands at 2,272 with 410 recoveries and 27 deaths. Following a recent unsettling developments reported about the Strandfontein temporary shelter for the homeless, which saw calls for its immediate closure of the city of Cape Town, invited the media of a site walkabout and press briefing. This is what transpired.
With the recent spotlight dawning on the Strandfontein temporary shelter for the homeless, which saw various organizations call for the closure of the site, like the ANC caucus, the city's Zaid Badruddin stated the reasons for the Strandfontein site at a site walkabout.
We had then moved to the identification or the need to identify a location close to the deep south part of the city, but also well placed to the Cape Flats area, so we could serve Fish Hoek, Simonstown, Ocean View, Mitchells Plain, Grassy Park, Wynberg, Claremont areas, because there was no temporary accommodation here. And so what the city had done was to sit with an entire list of facilities available to us, where we had identified the biggest facility or one of the bigger facilities that had ticked the number of boxes. What we were looking for, very importantly, was access to utilities, water, electricity, solid waste, other services, a well-fenced facility, a facility that has access to main transport nodes like Strandfontein Road, a number of other roads, the R300 not too far, that can bring in services very rapidly, and also ideally located close to a hospital facility which is just down the road for emergency medical services. And so one of the locations, or the only location on that list that was identified, because it ticked all of these boxes, was the Strandfontein Sports Complex.
Speaking to the issue concerning the vulnerability of all homeless people in terms of health, Badruddin said people undergo two types of screening upon arrival and on site, that being criminal and medical, which has resulted in 43 people being tested for TB, with 11 positive and 12 tested for COVID-19 pending results.
Every person who comes to site is asked about COVID symptoms. Every single person. It goes without saying. Secondly, these people who are being screened for COVID symptoms also are screened for TB symptoms as well. Also goes without saying, because of the burden of TB in Cape Town specifically. 43 individuals have been tested for TB, with 11 individuals returning with a positive TB test. These individuals have been isolated in our medical isolation tents that we've prepared, but also importantly, every single one of these individuals will be integrated into a hospital facility.
Speaking to the issue of safety, MACO member for safety JP Smith has highlighted the amount of law enforcement on site, including private security.
Then in terms of law enforcement, about 40 to 50 per day, or 40 to 50 per shift, should I say, and about 60 plus 66 private security as of this moment. So a combination of both. This is also a commitment we made to the local community. When the mayor first met with them, one of the concerns was that people would leave the site and become an impediment or threat to the surrounding community. That is perceived that they are an extremely, that they're a crime threat. And the city also made a commitment that we would ensure that there was adequate policing resources so that that threat was minimized. In terms of people escaping, in quotes, well, you can't escape because you can leave when you want. You can leave. So we have about 4 people a day at the moment deciding to opt out. The bulk of the people wanting to leave or walking out or climbing over the wall as it may be, however they see fit, are people who are coming down from various forms of addiction.
Closing the walkabout and media briefing, this is what Mayor Dan Plato had to say.
This is a massive operation. We treat it as very, very serious. Looking at our death rate in South Africa is still relatively low. Our identified infection rate also quite relatively low, but already the highest in Africa, but low compared to the Western countries and so on. And that is why we're taking these steps. And with certain halls.
For Our City News, this is Stephanie Pitt, Strandfontein.
Engagements with the communities of Dunoon and Kosovo informal settlements to discuss reblocking these areas have started. The National Department of Human Settlements last week identified Dunoon and Kosovo as 2 of 5 informal settlements around the country that have to be de-densified over concerns about the spread of coronavirus. Provincial Human Settlements MEC Tertia Simmons said that the de-densification plan formed part of this Rapid Informal Settlement Support and Upgrade Program, or RISUP. Epidemiologist Professor Salim Abdul Karim, chairperson of the Ministerial Advisory Group on COVID-19, has reported that South Africa appeared to have beaten the coronavirus curve in a way that no other country has. Abdul Karim added that the lockdown had been effective in delaying transmissions and easing the burden of healthcare facilities. But this week was a critical week for the COVID-19 response in South Africa and would determine whether or not the lockdown should be extended again.
Why? Because we want to know what the community transmission levels are. Because we want to use that to guide us on what next steps we should follow and how we should manage the lockdown. So by the 18th of April, we will know if community transmission and whether our interpretation that community transmission has been kept low, whether that's accurate. And if we look at the 67 cases per day on average, the 95% confidence interval is 45 to 89. In other words, the true number of cases is between 45 and 89. So we are 95% confidence that the number of cases per day, even though we're seeing 67, there's some variability, and that variability lies between 45 and 89. So using that as an objective criterion, now we have an objective way based on the R0. In other words, how many people is an infected person spreading it to? If we base it on that, then we have a set of criteria. If the average number of daily cases, and we have to exclude active screening because that's not comparing apples and apples, but if we look at just the passive cases between the 10th and the 16th of April, and if we see 90 or more cases on average between the 10th and 16th of April, then we need to continue the lockdown. And the reason, put very simply, is that the average number of cases per day is going up. So the R0 is going above 1. And we don't want that. We want to keep our naught at 1 or lower. If we're seeing a number of cases between 45 and 89, then we are in the same region as 67, right, within the margin of error. And there we want to use our community prevalence. What is the active case finding telling us? And if that active case finding has a screening to positivity to screening ratio that is above 1 in 1,000, then we continue the lockdown. If it's below 1 in 1,000, then we can ease the lockdown. Similarly, if the absolute number of cases is 44 or lower, we can ease the lockdown because it tells us R naught is less than 1. So you can see that using epidemiological criteria, we create a set of a clear approach as to how to deal with the lockdown. Now you must expect that there'll be large daily variations, right? Because just the way the timing of the lab tests and so on. So you will see that. And you will see some large numbers, some small numbers. Don't let that bother you. You have to look at it over a period of time. And so that's why we look at a whole week at a time. And we compare weeks with weeks so that we're comparing apples with apples. We know that if we end the lockdown and we end it abruptly, we may run the risk of undoing all of the effort and the benefit we've achieved. Because then we'll be putting high-risk and low-risk people together, traveling in the same buses, taxis, trains. We have to do something about that. We have to avoid that situation. And so we need to think about and plan for a systematic easing of the lockdown, starting with transport hubs and then working our way down from the lowest risk to the highest risk. Next slide.
A 9-month-old pit bull cross puppy has survived a vicious chainsaw attack. It appears Bruno came to his owner's defense after an unknown assailant entered the owner's property to collect firewood. When he refused to leave, things got ugly and the puppy was stuck by a chainsaw. The puppy was admitted to the Animal Welfare Society hospital over the weekend with severe lacerations to his head and body. The Animal Welfare Society said it would lodge a complaint against a man who allegedly attacked a dog with a lethal tool. There is some relief in sight for waste pickers who are not regarded as essential service and they have been hit hard by the national lockdown. Environment Minister Barbara Creasy said an intervention had been launched in which the packaging industry and her department would distribute electronic vouchers to waste pickers' cell phones. Creasy said 3,925 waste reclaimers would receive vouchers this week, and the voucher system would help elevate the logistics of delivering food parcels. Now it's time for an ad break. We'll be back shortly. Welcome back. You are still watching our City COVID-19 news show with me, Michaela Miller. We'll be giving you the latest updates of the COVID-19 pandemic and sharing essential resources and information with you. Leader of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, warns nations across the globe against lifting government lockdowns to contain the COVID-19 outbreak to soon play.
Countries and communities have now endured several weeks of social and economic restrictions. Some countries are considering when they can lift these restrictions. Others are considering whether and when to introduce them. In both cases, these decisions must be based first and foremost on protecting human health and guided by what we know about the virus and how it behaves. Since the beginning, this has been an area of intense focus for WHO. As we have said many times before, this is a new virus and the first pandemic caused by a coronavirus. We're all learning all the time and adjusting our strategy based on the latest available evidence. We can only say what we know, and we can only act on what we know. Evidence from several countries is giving us a clearer picture about this virus, how it behaves, how to stop it, and how to treat it. We know that COVID-19 spreads fast, and we know that it's deadly, 10 times deadlier than the 2009 flu pandemic. We know that the virus can spread more easily in crowded environments like nursing homes. We know that early case finding, testing, isolating, caring for every case, and tracing every contact is essential for stopping transmission. We know that in some countries, cases are doubling every 3 to 4 days. However, while COVID-19 accelerates very fast, it decelerates much more slowly. In other words, the way down is much slower than the way up. That means control measures must be lifted slowly and with control. It cannot happen all at once. Control measures can only be lifted if the right public health measures are in place, including significant capacity for contact tracing. But while some countries are considering how to ease restrictions, others are considering whether to introduce them, especially many low and middle-income countries in Africa, Asia, and Latin America. In countries with large, poor populations, the stay-at-home orders and other restrictions used in some high-income countries may not be practical. Many poor people, migrants, and refugees are already living in overcrowded conditions with few resources and little access to health care. How do you survive a lockdown when you depend on your daily labor to eat? News reports from around the world describe how many people are in danger of being left without access to food. Meanwhile, schools have closed for an estimated 1.4 billion children. This has halted their education, opened some to increased risk of abuse, and deprived many children of their primary source of food. As I have said many times, physical distancing restrictions are only part of the equation, and there are many other basic public health measures that need to be put in place. We also call on all countries to ensure that where stay-at-home measures are used, they must not be at the expense of human rights. Each government must assess their situation while protecting all their citizens, and especially the most vulnerable. To support countries in making these decisions, WHO will tomorrow be publishing its updated strategic advice.
The city of Cape Town demolished shacks belonging to the land occupiers in Impolweni informal settlement, Khayelitsha, on Thursday. The following video was shot and produced by Zachariah Mashele from Hindufuna Nkwazi.
On the 15th day of the lockdown in South Africa that was announced by the president, the residents of Impolweni find themselves with no homes. The anti-land invasion and law enforcement came into this area and demolished people's homes. This is sad because on the regulations, the president announced a moratorium on evictions and no one will be evicted over this 21 days lockdown.
So ndabona bakhona indawo ekuthiwa kubekwa khona and ndingumntu aphayeliyo ndikhulelwe so xa ndizokwazi urenta and futhi khona le nto ye-lockdown iibhizinesi zivaliwe bendingumntu othengisayo so kuvele kwavala kwaye kulaa ndawo bendithengisa kuyo andisakwazi umela umntanam uba ndimondle nawo umntana but akekho phambi kwam ngoku.
Into eyenzekayo ulo enforcement xa yefika apha engena phaa egeyithini sesiyazi into yokuqala abayenzayo siye sijonge uba banazo na i-name tags abanazo bazihayidile. Asikwazi ubuza nto xa bengena phakathi endlini abangeni phakathi endlini bakunika i-chance bathatha impahla uyibeke phandle bafika namala amadoda baze nawo singawazi avela phi babethe indlu ilale phantsi.
Namhlanje ke nguye wafika i-enforcement ihlala kule ndawo. Ifika kwayo yafika yachithela abantu. Yawungena nalapha kum afika nise lapha endlini phakathi. Yabo. Bathi maniphume. Yabuza uba ndiphuma ndiyaphi. Yabo. Bathi maphuma apha endlini bafuna ukuchitha le ndlu. Yathi andikwazi ukuphuma apha endlini because ngandizochitha nendlu. Yabo. Othi ndichithe ndiyephi ndiyohlala esitratweni because akunandawo hlala. Yabo. Apho ngizofuna umsebenzi. Yabo. Sekuhlupheke ndiyahlupheka kule ndawo ngikuyo. Yabo. Hayi khange bafune babantu ndanduke ndiyanduke ndihlale yabo. Baye bandibetha ukuphuma kwam apha endlini. Banditsalatsala bandibetha.
Sicela urhulumente asithethelele asilungiselele kuba sinandawo bethuna. Siyayicela loo nto leyo kambe nabanye basuke beyanxusini babo bagxothiwe iyaqonda. Ngoku sicela kakhulu kurhulumente noko asivele imfesana kuba siyazi uba siyephi na and kule ndawo lena asiyidelelanga ngoba sizapho iyaqonda bhuti wam asidelelanga uba nali ithafa likhona qha siziswa ziintlungu zethu ngeentlungu zethu iyaqonda bhuti. Uyandiva njengangoku mna ndithi ngoku andiyazi noba ndizawuthini ngoku njengangoku uyaqonda.
Namhlanje bafikile uLand Vision wangena ngemoto yakhe wangathi ubheka ngapha ezantsi apho ziqala khona izindlu wabelandelwa imoto encinci ye-law enforcement waphinde wajika waphuma. Xa bephuma abe sesiza amabanjwa akayaza akabuza azafike ephethe intsimbi afika amabanjwa afika aqala kwindlu yokuqala ayibetha. Umntu uba wenza kade ukhupha impahla ababuzi uba eza mpahla bazuyisela ngeza zindlu. And kwayena ubanjwa ngesixhanti ubanjwe kanje umntu alahlwe phaa ngaphandle ngaba bantu. Abakucengi uba thatha impahla zakho uphume sizawuchitha le ndlu ngoku. Kuthiwa phuma ngaphandle. Bakaphuma umntu ubanjwa noba umntu uba uyahlamba abakhathalelanga uba isidima sobantu nabantu abangoomama abasikhathalelanga uba uyahlamba ubanjwa kuthiwe bhinqa into uphume phaa ngaphandle. Uphuma njani ungumntu ongumama uphume uhamba ngaze kugcwele abantu apha. Asikhathalelekanga thina bangoomama kuba siyahlukumezeka njengoba sizohlala kwezi ndawo nje asizange uba sithande. Siyacela isidima sabantu abangoomama sibaluleke kurhulumente wethu.
Conflict over how to respond to land occupations during lockdown reached a boiling point on Sunday when the City of Cape Town law enforcement officers allegedly shot at land occupiers protesting against the demolition of the shacks in Mpilweni. Kaya Licha, a ground-up reporter who was on site, said about 60 protesters were singing struggle songs in front of the officials. The reporter said there was no provocation when law enforcement began firing and that at no point did he see anyone throw a stone or use any kind of violence towards the city officials. Our city spoke to Councillor Malusi Boy of the City of Cape Town's Land Invasion Unit, who said the officers were protecting the site against illegal invasions. Boy said occupiers were contravening lockdown regulations and the city had a court interdict to remove the occupiers. He denied live ammunition was used.
So what you've just seen now is the rubber bullets and the live ammunition that the police were using to shoot at the community members at Mpilweni. And there's done grenades and live ammunition. They've been shooting at poor people who have nothing but calling for their homes to be rebuilt. So this is the situation. Police of Cape Town have been shooting at our people who are defenseless, who are unarmed. They've been shot at by the police.
The residents of Mpilweni Makaza were building their houses after they were demolished yesterday by the law enforcement. So whilst they were building their structures today, the law enforcement came again in large numbers, and they sent the anti-land invasion unit to demolish some of the structures. And then after the wind, the structures were demolished, and then some law enforcement started firing rubber bullets. That's when people dispersed and everything just became chaotic.
Mna ngoluvo lwam ndifila as if iselixesha lakudala lengcinezelo ngoba I didn't understand into yoba ngo-2020 sibe kanti singabantu abamnyama ngenxa yento yoba silwela inkonzo neendawo zohlala ibe kanti sivingcelwa ezindlini nge-tear gas sihlukunyezwa siphathwa kongathi singamakhoboka. Impatho esifumene namhlanje empolweni yobukhoboka period ayinayo enye excuse ayinayo enye justification yobukhoboka.
When I saw police shooting at people with stun grenades, with live ammunition, they just kept on like going inside where the people were. It's like they were trying to provoke the people, even though the people were moving back, but then they kept on moving forward and going inside people's yards, searching for people.
Into enzekileyo namhlanje ibe rongo nyani kuba kaloku abantu funeka niqale nithethe nabo. Abantu bacaphukile ba-frustrated, abanendawo zolala, abanendawo zohlala. So ndicinga uba bekumele kuthethwe kuqala nabo ngamapolisa okanye law enforcement yena ofike kuqala aqale abize iinkokheli zasempolweni ahlale nazo phantsi azibonise noba zicaphuke kangakanani but bona kuba baqeqeshiwe how to calm a crowd and more especially abantu abaqumbileyo. So ayenzekanga loo nto, instead bavele bama phaa ithuba elide i-law enforcement neeveni zamapolisa bema, which means bebesapleyina uba bazoqala ngaphi kwenza le nto. And baye balinde abantu babeka izindlu kwakhona baphinde babethelela abantu izindlu, then bathi xa begqibile abantu ukubethelela bafika sebebhoboza izindlu and sebengasaqheliseli betshintshe ebusweni like ibingathi ngabanye abantu benye iplanethi.
Ndisifilisha kabuhlungu mna just because imini yami yokuqala uba ndibone kwayinto ethi gas ndidla ngobona nje kwi-TV neentoni nalapho besizivalele hoki noba besi-more than 8 kuba lokhu indlwana encinci.
This morning, the Legal Resource Centre appeared in the Western Cape High Court, saying the recent demolitions of homes and the eviction of residents in Mpilweni in Khayelitsha were a clear violation of the national disaster regulations. They said some of their clients' homes in Mpilweni were erected last year in June and that more than 103 homes were demolished, contrary to the City of Cape Town's information that only 30 homes had been taken down. We will have more of the story tomorrow. We are taking a short break, and when we come back, Octavian Global will dispel the latest fake news.
Welcome back. Before the ad break, we had Michaela Miller with the latest news. Last week, Stephen Birch was charged with spreading fake news after a video circulated on social media in which he discouraged people from participating in COVID-19 testing because swabs were used with contamination. He was released on a warning and is expected to return to court on the 14th of July. In South Africa, a new law under the Disaster Management Act, Section 11(5)(c), states that citizens could receive a fine or 6 months in prison for spreading fake news about the coronavirus. We encourage our viewers to think before they click to share on social media. If you're unsure of a video or WhatsApp audio you've received, you can send a message to AfriCheck. It has set up a WhatsApp fact-checking group to help citizens verify that information is correct. You can add them on 082-7093-527. Students who attended Crystal House, South Africa are caught in the grips of the COVID-19 lockdown. Yet they've shown immense dedication by continuing to work hard on their schoolwork. While they are at home, many donors have come forward to pledge their support to some of the school's most vulnerable families during the lockdown. This is our student way of saying thank you. Right after this clip, we'll have one from South African comedian Trevor Noah.
At Jerusalem, I believe I can realize my fullest potential. good citizen and giving back to my community.
Better, Your Majesty, sighed Billy. But do try to. Try to what? Snapped Queen Nora. Well, said Billy, it will help if you sound a little happier.
Hi friends of Kisla, South Africa. My name is Alita da Costa. I would like to thank you for the support and the generosity that you have shown to our school. Thank you for being remarkable. Stay safe and have a great day.
South Africa, my name is Trevor Noah, and I just wanted to say hello to you during this horrible, horrible time. Coronavirus has taken over the world, my friends. We're stuck in our houses. They've told us we can't go outside. And now we're stuck waiting for this 21 days to end. All over the world, we're going through the same thing. And all I can ask you as my fellow South Africans is to, guys, please, let's work together on this. Some people do need to go to work. Some people have to go outside. But let's make it safer for them by playing our part. You can stay at home. You can FaceTime with your friends. And you can braai indoors. Just don't burn down your mom's kitchen. Until that time is over, let's do this thing and let's beat coronavirus. Stay safe, everybody.
And now for social media. Share your thoughts with us on Facebook, we are Our City CT, and on Twitter at Our City CT. This is a time that we need to come together as a nation. These are the popular hashtags on Twitter today. If you want to be a part of this conversation, you can do so by visiting our Facebook page using the hashtag #CTVCOVIDShow. COVID-19. About half of humanity is living in lockdown conditions. Meanwhile, in South Africa, Professor Salim Abdul Karim, chairperson of Health Minister Zweli Mkhize COVID Advisory Group, believes the country's peak infection rate could be later this year. Malawi. Malawi has received debt service relief from the International Monetary Fund so it can divert its resources to fighting the coronavirus pandemic. Mkhize. Health Minister Zweli Mkhize has expressed concerns over the death of a 57-year-old man in Gauteng who had no underlying conditions before dying from COVID-19. He said the results of tests concerned medical experts. Thank you so much for staying with us. After the break, we'll have Michaela Miller with the latest resources.
Welcome back. You're still tuned into Our City, the COVID show with me, Michaela Miller. Before the ad break, Octavia Ndlovu looked at what has the nation buzzing on social media platforms. If you want to watch the repeat of this program, you can tune in again at 6 p.m. for your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe. Speaking about what Cape Townians are doing, here are some organizations helping communities stay safe. Athlone House of Strength, established in 2001, is a shelter for abused women and children. They also offer telephonic counseling. If you need assistance during the lockdown or would like to assist, contact 021-862-9983. Mosaic offers counseling and legal aid for women and girl survivors of domestic violence and abuse. For assistance, contact 021-761-7585. South African Depression and Anxiety Group, a 24-hour helpline is available if you need counseling for depression or anxiety. Contact 0800-456-789 or SMS 31213. Food for COVID-19. The National Association of Child Care Workers is distributing food parcels to the vulnerable families and children. If you are able to donate or need help, contact 082-418-7918 or 082 550 9465. Solomon's Haven help feed 500 elderly people, children and homeless people in the Cape Flats area. To donate, contact Khanif on 083 485 7921. That's all we have for you today. But if you have something to say, daughter, we want to hear from you. Send your comments, news and questions to us via Facebook at Our City CT, or on Twitter at Our City CT, or get in touch with us via email on ourcity@capetowntv.org. This is a time that we need to come together as a nation. That's all we have for you today. From myself and Octavian Glovo, goodbye.